Namaste, Dakshaben.
Yeah, Shirley is here. Namaskar, Shirley. Shirley is here.
Namaste.
Nice seeing you.
Nice to see you too.
Namaste, yoga family.
Namaste, namaste.
Namaste. This is Subramanian Kumar from Tampa.
Pranam, Jaideep ji. Can you please log in? Acha, so I can log you in. That's hanji. Please, yeah, early please. एक बार log in कर दीजिए बस. We can take it. That's all. Then फिर कोई बात.
फेस तैयार है सीता. या तो थोड़ी देर वास्ते कर दा, बंद कर दा. बहुत ज्यादा.
Hello. Namaste. अच्छा.
उससे तो ज्यादा है.
No, but you that is going live now. It's a live coverage. You see a lot of pictures, everything.
हाँ?
Yes.
नहीं, वो शुरुआत ही कर देंगे.
Okay. Wonderful. Good. Thank you.
तो नमस्ते कर दो.
So far, technology is all working.
So Shekhar, there are around 43 now. 44, yeah.
Yes, please. 44 in the meeting. Okay. Patanjali Japan.
Namaste Shekhar ji, Namaste Brett ji, Namaste everybody and best wishes. I will be soon, but Survinder will be here and she will be joining. Namaste and good luck to everybody. I will really miss it.
Namaste ji, Om, all the best. Namaste yoga family. Ashutosh from Japan.
बहुत ज्यादा.
Ashutosh ji, namaste, welcome, thank you.
नमस्ते जी, नमस्ते. हमारा तो सोने का टाइम हो रहा है अभी, पर आपका ऑल द बेस्ट बोलने के लिए आया हूँ. ऑल द बेस्ट.
मेरे मुंह पे बहुत ज्यादा.
मैं लेकिन फेसबुक लाइव देखता हूँ इसको और देखते देखते सोते सोते देखूंगा. ठीक है, ऑल द बेस्ट.
बहुत बहुत धन्यवाद जी. थैंक यू.
हाँ जी, थैंक यू.
वो करना पड़ेगा बहुत ज्यादा. धूप आ रही है, 2 मिनट वास्ते कर दो फिर बंद कर देना.
We are almost there. Just waiting for our chief guest so we can get him in, and then we will start the session very, very soon, please.
Namaste, Shekhar ji.
Namaste ji.
So until your chief guest comes, can I speak for a minute or so?
Yes, please.
Lots of people, every second, one senior is falling because of poor balance or poor core or aging processes. So in order to prevent the fall, fracture, disability, and premature death, everybody can improve their balance by tree pose yoga, or by the yoga sessions by Dr. Narayan gives that, the bending on the chair, on the floor. Improve your core, improve your back, lower back, improve your leg muscles by mild weightlifting or other procedures. Ask your yoga teachers or family or friends to improve your balance and core to prevent falling, fracturing, disability, and death. And Japanese looked into the brain of people who could not stand on one leg for 10-20 seconds. Their brain was full of biomarkers of stroke and Alzheimer. Whereas people with a strong balance, they had a crystal clear brain. So after reading that publication 5 years ago, I went in the corner of my office at NIH at that time, and I could not stand for 5-10 seconds. But over time, I improved my balance, And I request every seniors to teach it, learn it, teach it to 3 people every day in your life. And thank you so much. This is Naresh from Yoga Family, from Dr. Narayan's family. And have a blessed session and blessed Sunday, and dissipate the knowledge of yoga to everybody in your family, friends, and globe and beyond, for the good of everybody. Thank you. Thank you so much, Bhai Sahab.
Thank you. Namaste, Jaideep ji.
Pranam. Pranam, Bhai Sahab. कैसे हैं?
Very good.
How are you?
Good. Very nice. Thank you.
कैसे है our whole team of USA Trust?
All well, and we are joined here. So we are ready to start. We are live on Facebook.
Okay.
Om and Namaste to everyone. I welcome you all to this timely webinar on yoga therapy for COVID-19. Before we get into today's topic, I would like to update a few highlights about Patanjali YogPeeth USA Trust. My name is Shekhar Agrawal, and Yoga Rishi Puja Swami Ramdev Ji Maharaj has appointed me. Everybody is in the mute, please. Puja Swami Yoga Rishi Puja Swami Ramdev Maharaj Ji has appointed me to look after the activities of USA Trust. We have been conducting yoga teacher training workshops since 2008. So these yogis can conduct yoga classes in their communities and in families to keep a lot of people healthy. Earlier this year, we purchased 8 acres of land right in the city in Houston, and now we are busy finalizing the conceptual design of this Patanjali ashram for Ayurveda, yoga, and naturopathy. This should be completed in first half of 2022. We will share many more details in the near future, and then we will ask all of you to join us in this ashram. And now back to our today's topic. I could not have imagined of an event where the whole world would shut down. The virus has even invaded the White House now. There are no boundaries for this infectious disease. In fact, I was tested positive in July, and I had very minor symptoms for a few days. This pandemic is of a great concern in USA as well as in India, as well as in many other countries, as the count of the infected people and the death due to this virus are going higher and higher every day. Today, a number of excellent researchers and yoga practitioners have joined us to answer many of our COVID-related questions, and hopefully will offer us some guidelines to minimize the effect of COVID-19 on us, so that we all fulfill our goal to live 100 years and more independently. Remember, Ved Bhagwan says, Jivem Sharda Shatam, means, hey man, have the desire to live 100 years and more independently and work for it. Yeah? Yoga is an ancient science and technology given to the world by the Indian sages. It's a secular practice for self-health, happiness, harmony, peace, and bliss. About 5,000 years ago, sage Patanjali defined yoga as chitta vritti nirodha. Cessation of the fluctuation of mind is yoga. And he showed us the path of moksha, the complete liberation from the cycles of birth and death. That's why Yogeshwar Bhagwan Krishna says to Arjuna in Gita, means to all of us, Tasmat Yogi Bhava Arjuna, hey Arjuna, be the yogi first, all will fall in place. Yogeshi Swami Ramdev Ji Maharaj says, Karo Yog Raho Nirog. Do yoga in your daily life and stay healthy, as good health
Cannot hear anything.
Shekhar ji, we cannot hear anything. We cannot hear
the voice.
Yes, I'm back. Yes. Thank you. Yes, this is Natasya roga na jara na mrityu praptasya yoga agni mayam shariram. अगर हम योग अग्नि में अपने आप को तपा लें तो हमें कभी रोग नहीं होंगे, कभी बुढ़ापा नहीं आएगा और कभी अनटाइमली डेथ भी नहीं होगी. You know, we practice yoga in daily life that will protect us from all kind of diseases and old age and the untimely death. So good health is the side benefit of yoga. Let's all practice yoga in our daily life for a happy, healthy, long life, and finally fulfill our ultimate goal of moksha, the liberation. Today, we are honored to have 4 distinguished speakers, Dr. Jaideep Arya ji, Dr. Shirley Telles, and Dr. Dilip Sarkar, and Dr. Rajan Narayanan. Each will speak for about 8 minutes after their brief introduction. After their talks, we will open the session for Q&A, and we'll keep everyone in the mute mode for now. And you can write your question through the chat box. This event is also live through our Facebook, facebook.com/pyptusa.org. Sorry, facebook.com/pyptusa. Please join us there in case you cannot. Our capacity in the Zoom is fills up. So now it's my pleasure to welcome Dr. Jaideep Arya ji, the Chief Central Coordinator or Mukhya Prabhari of Patanjali YogPeeth Haridwar, founded by Yog Rishi Swami.
No sound.
We cannot hear you.
Shekhar ji, you have muted yourself.
Okay, I am unmuted. Actually, the participants actually comes in and we mute also. By default, I get muted. I'm back on that. So our Bridge Kamboji is looking after that. Please, Bridge, in case I get muted, please unmute me. So again, let me start over for our introduction to our Dr. Jaideep Arya ji, who is the Central Coordinator, Chief Central Coordinator of Mukhya Prabhari of Patanjali YogPeeth Haridwar, founded by Yog Rishi Swami Ramdev ji Maharaj and Ayurveda Shiromani Sardar Acharya Balkrishna ji Maharaj. Dr. Arya is a BA MS in Ayurvedic medicine, PG in acupuncture, MSc in yoga therapy. He has published research work on the management of obesity by yoga practice. He is the Joint Secretary for Indian Yoga Association. He has received numerous awards from many state governments and Government of India in the field of yoga. He has led, managed, and coordinated International Day of Yoga programs at national level in many large cities over many years, including the gathering of 200,000 yogis at a single location in Kota, Rajasthan, and 500,000 yogis in Ahmedabad, Gujarat. I believe this is the largest yoga gathering at a single location. I claim that Puja Swami Ramdev Ji Maharaj is the most known person in the world, where 15% of the population knows him as Yoga Guru. To be the chief central coordinator for such a large following is a huge task, and Yogi Jaideep Arya ji is doing this with very ease for many years. Let's please welcome our Dr. Jaideep Arya ji.
Pranam Shekhar ji, pranam to all of you, all the speakers of the webinar. We welcome you all, and I want a permission of sharing my screen.
Yes.
Can
please.
I share?
Yes, you can share it.
Okay. We are today discussing about the management of the COVID patients. And what are the main symptoms of the COVID patients? Headache. You lose the smell, you lose the taste. You all know is pain, whole body pain, diarrhea, dysentery, redness of some particular skin part, and specifically dry cough and redness of your eyes. Is all you know how to safeguard yourself by way of cleansing your hands time and again, how to use tissue paper for the coughing, and how not to touch your face time and again to safeguard yourself for the COVID. For the COVID patient, those who are in the clutches of the COVID, they have to start with the loosening exercise first of all. The government of India as well as various yoga organizations worldwide have recommended yoga and yoga-based lifestyle suggestions to help persons remain mentally healthy, as well as promote optimal immune functions during the current pandemic. The first challenge is the anxiety, the fear. When we saw the videos of Wuhan, China videos, people are just walking and just falling down. That created a panic throughout the world. Everybody in the world, more than 200 million people, they are stuck with this anxiety and stress, fear. 200,000 people of the world. And yoga provides the potential co-benefits of both physical and psychological health. India has the most number of the best recovery rate. Addressing the nation on the day, Prime Minister Narendra Modi said that yoga boosts the immune system of the body. You must include pranayama in your daily life. Pranayama, yoga, or breathing exercises strengthens our respiratory system. It is more relevant in the current times, as it is the respiratory system of the body that is most adversely affected by the COVID-19. So, one aspect is psychological, one is emotional, third is physical. Vital organs are, specifically lungs, are affected. And in post-COVID patients, we saw a chronic fear, anxiety, stress, including anxiety and stress. There is a chronic fatigue. From 8 weeks to 12, 16 weeks, it sustains. Cardiac palpitations. Post-COVID patients, they are having it regularly. Insomnia, liver diseases, and pranayama exercises, yogic exercises are the best for this. Conscious breathing involves the function of the cerebral cortex in the brain, which processes out thought mechanisms such as clear speech, decision making, and reasoning. With improved and clear breathing, yoga and meditation help to enhance the functioning of lungs and alveoli. And we saw in post COVID patient, alveolar destruction is the major part which we have to address. And by way of breathing practices, it not only help calm the body and mind, but are known to develop a higher and constant source of energy in the body. I suggest some of yogic postures to maintain our immunity. Immunity means 55% of the blood is plasma, 44% is RBC, and rest 1% is platelets and WBC. And for the sake of WBC, it generates in thymus gland, in bone marrow, in spleen, liver is also involved. All these vital organs, you can give the activity by way of stretching, by way of pranayam, and specifically Ujjayi pranayam is the best for the sake of maintaining the immunity, developing the WBCs in our body. So I suggest some postures: Tadasana, Trikonasana, Shalbhasana, Nokasana. And these are some pranayams. Bhastrika pranayam, the best for the lungs, for the alveolar destruction. You can do Bhastrika pranayam, inhale deep and exhale it out. Anulom Vilom pranayam. And one naturopathy practice. This is called Jalneti. In India, one very renowned hospital is there, Nanavati Hospital. Each and every doctor of this hospital is doing Jalneti early morning and evening. And you can't imagine, not a single medical doctor infected with the COVID during this last 6 months practice. This much effective this practice is, that is called Jalneti. And Param Shraddha Swamiji Maharaj stressed to do it, and Nasya, Anutel, we advised coronal specifically for the sake of immunity. Param Shraddha Swamiji Maharaj, Param Shraddha Acharya Shri advised to take Ashwagandha, Giloy. Ashwagandha means the Vithani somnifera. Giloy means the Tinospora cordifolia. So for the management of the COVID patient, we have to see the WBC should be there, and the detoxification of the body should be there. Proper management of the immunity and immunity cells, WBC should be generated timely. We have to take accordingly a very soothing diet. Vitamins, vitamin C advised, vitamin D, you have to take the sun bath. This is, and one Ayurvedic kada. And during COVID infection, even although you have to do some loosening exercises, Shakti Vistarak, Tadasana, Bhadrasana, very light exercises you have to do. To maintain your metabolism, we advise the Shashakasana, Mandukasana, Bhujangasana, Ardhalasana, Gomukhasana. Gomukhasana is very good for the lungs activity. Ushtrasana. And Nadi Shodhan Pranayam, Bhastrika Pranayam. Again, so you have to focus on your dietic part. Diet should be very good. Nutritional diet should be there. And we have to take hot, not use, we should not advise. And I recommend that we should take hot milk, golden milk, which you use the milk with the turmeric powder. It is highly effective for this immunity and for the sake of the health of the lungs. There are three major parts which was advised by the Ayurveda also. Maharshi Charak says Ahar, Nidra and Brahmacharya. For the sake of your immunity, you have to focus on your diet. Your sleep is the best part of your immunity. Take proper soothing sleep. It is highly advised, and I advise to take a proper 8 to 10 hours sleep for the patients. Vitamin C is highly advised, and maintain a discipline in it. Do 2 hours early mornings postures and pranayams, evening 2 hours postures and pranayams, and that's all from my side because the time is running very fast. And I suggest, for the sake of just to maintain your immunity, we have to protect ourselves. Metabolism should be in a proper manner so that other diseases cannot come to our body. One part, we have to defend ourselves from the COVID, and we have to maintain ourselves healthy. The focus of Ayurveda is swasthasya swasthya rakshanam, aturasya vikara prashnam chaha. We have to maintain the health of the healthy body or healthy person, and we have to manage the health of the cure one. So there are two aspects. One is COVID patient and post-COVID patient. In COVID, you have to do the gargles. You have to take the golden milk. That is advisable for the sake of your throat infection, for the sake of your lungs infection, and for the sake of post-COVID. Where is the major part is your fatigue. So we advise Yog Nidra. Yog Nidra is highly advised for the chronic fatigue. Proper vitamins and minerals should be taken. And we advise the coronal. Coronal is the, in present scenario, Patanjali YogPeeth have invented by way of Patanjali Research Institute. And we have the database with us. More than thousands of persons are having the details. They are the present testimonials are with us. The first person of India who got infected with the COVID, Rohit Datta, he is the best testimonial. He told that by way of doing pranayam, I got cured within 5 days. And we have the testimonials, hundreds of testimonials there with us by using coronal tablets, Shwasari tablets, Nasya. People are getting benefit and they are recovered from the COVID infection within 3 to 5 days. So I suggest you to do pranayam, asan, postures in a regular manner. More stress should be there on the pranayam. Pranayam is the best medicine for the COVID patients. Your disciplined lifestyle and diet is the second major part. And third is your nidra, your sleep. That's all from my side. Thanks a lot to all of you.
Thank you, Dr. Jaideep Arya ji. Wonderful. Give us a lot of different clues, different ways to overcome the COVID. I have a request in the chat box. Only add the questions related to COVID-19, not the greetings or some other miscellaneous messages, so we don't lose those your questions, please. And now it's my great honor to introduce our next speaker, Dr. Shirley Telles. Dr. Telles has a degree in conventional medicine, MBBS, after which she completed a MPhil and PhD in neuropsychology at the National Institute of Mental Health and Neuroscience, Bangalore. For both MPhil and PhD, Dr. Telles' theses were related to the effect of yoga practice and their application in health and rehabilitation. After her doctorate, she joined Swami Vivekananda Research Foundation in Bangalore. And I know Dr. Telles from around 1997 as I was taking my yoga teacher certification from SVSL then in Houston. She is the director of research at Patanjali Research Foundation since 2007. In 2012, Patanjali YogPeeth USA Trust also funded a combined study project covering yoga as a good form of physical and mental education for children with Brigham and Women's Hospital of Harvard University and Patanjali Research Foundation Haridwar. She is the world's most published yoga researcher, as she has, as of now, 198 publications, and most of them are published in the world famous medical journals. She also has authored 8 books, and I'm so happy to share that her latest book, Handbook of Research on Evidence-Based Perspectives of the Psychophysiology of Yoga and its Applications, was formally released today only. We all want to understand how the body and the mind interacts, and I'm sure this handbook would be a great manual in the medical field. My heartiest congratulations to Dr. Telles, and she religiously practices yoga on a daily basis. And I now welcome Dr. Shirley Telles.
Namaste and greetings from India. Thank you, Shekhar ji, for that kind introduction. And in the next few minutes, I'm going to talk about the use of yoga, especially pranayamas for COVID-19. So I'm going to share my slides in this minute. Okay. So let's see how yoga can help for managing 2 phases. The active phase. When I say active phase, I mean if a person has tested positive or if they have been in close proximity to someone who's positive and is now in quarantine. As we've already heard nicely from Dr. Jaideep, yoga can do a lot to optimize immune function, a slightly better word than boosting it. It can also do a lot for our mental health, allaying anxiety, reducing the stress of being socially isolated, and as well as anxiety related to so many other factors in the changed life post-pandemic, and optimize also our cardiorespiratory functions, including higher levels of oxygen carried in our blood. So this is for someone who's positive and or a person who's in quarantine, wondering if they may turn positive. And let's see towards the end of this presentation, which pranayamas may be specially suggested based on the evidence or on the research, published research. What about life in the pandemic? All of us are in a stage where we don't know when we may test positive, or as Shekhar ji mentioned, if you are positive at some time, how to manage after that not to get reinfected. There's a lot that yoga can do to keep our mental status very positive, a sense of increasing our eudaimonia or mental well-being, our life satisfaction, and overall quality of life, and what we call nowadays, not just removal of anxiety and social isolation, but positive psychology is reinforced. And apart from that, we all are so much of the day online, either for work or even for social interactions or something very nice like this chance, which has brought the yoga family together. How can we use technology in a healthy way so that we don't have eye strain, musculoskeletal strain, and so on, is very much possible through the effect of yoga. Let's move on and see which pranayamas I'm going to cover. So 5 categories. And the very first one that I'm going to talk about is Anulom Vilom Pranayama. Now, Anulom Vilom Pranayama is an alternate nostril yoga breathing. And there is one effect which has stood out from research which began in the 1980s and is continuing even today. And this is the effect on the blood pressure. There are 3 main blood pressure readings which really stand out. That is the systolic, diastolic, and the mean blood pressure, which is the blood pressure throughout the cardiac cycle. Now, irrespective of whether a person is normotensive, that is having normal blood pressure, or hypertensive, where their blood pressure being raised, or even a person who has hypertension and is asked to do a specific task which normally raises the blood pressure, we have found that 3 epochs, each of 5 minutes, practiced with 1 minute gap in between, which is the duration suggested by our founder, that is respected Swamiji, Swami Ramdevji, that is a total of 18 minutes of time required for Anulom Vilom Pranayama, very clearly reduces the blood pressure, systolic, diastolic, and the mean blood pressure across the cardiac cycle in both normotensives and hypertensive. Now, why is this important? It has really stood out that there is research in India and also in the US, which is very good for this particular webinar, that many people who were normotensive at the start of the pandemic have become hypertensive during, either because of anxiety or less physical activity. So very useful information about here about Anulom Vilom Pranayama definitely reducing the blood pressure. Moving on, it also has a calming effect on the brain, which is very good in allaying anxiety. So every reason to practice Anulom Vilom Pranayama. This too has been published and is based on the EEG. We'll move on to the next, Kapalabhati. Kapalabhati, again, so well practiced in Patanjali YogPeeth. Everyone is very well familiar with this, thanks to the wonderful efforts of our founders, Swami Ramdevji. And Kapalabhati suggests that there's activation of the brain. Indeed, we have studied it in PRF, that is Patanjali Research Foundation, with a number of sensors, including functional near-infrared spectroscopy, which gives very important information. Many people get anxious that when you breathe at this fast rate, that you're going to activate the brain so much that a person will feel anxious. So one of the first studies we undertook when we set up the lab was to check, is there really this hyper-arousal of the brain, which can tip the person into anxiety, and if it goes still further, make them even prone to something as dangerous as epilepsy, because many people have this kind of fear way back like 10 years ago. So we did systematic studies, and we actually mapped the activity in the brain. I'm not going to go into this complicated graph. Sufficient to say that with Kapalabhati practice, you can perform very well in attention tasks, but there's no hyperactivity of the brain, no risk of going into a hyper-anxious state. But on the other hand, the metabolism is really primed so that there's a 41% increase in energy expenditure. Just sitting in your chair, you don't really have to go out and jog or do some aerobic exercise. You are able to burn 41% more calories compared to the pre-state, just practicing Kapalabhati. And here the rate that we recommend is 45 to 60 breaths per minute. Very useful, particularly when people don't want to go out and exercise in parks or public spaces. Just sit in your chair or sit on the ground and you have this wonderful effect. So we recommend Kapalabhati to increase alertness, short-term arousal, and as a very effective exercise, particularly during this pandemic. Then we move on to the next condition, Bhastrika. As already mentioned very nicely by Dr. Jaideep, there is an increase in lung functions with Bhastrika, but there is still much more scope to look at this in thorough detail and see which functions improve. Is it really increasing oxygen saturation? And this is one of the activities we are currently doing in PRF. What has been conclusively shown to improve with Bhastrika is another function, and this is called reaction time. What is reaction time? Suppose you hear your phone ringing. How much time does it take for you to reach out to your phone and respond to it? How reactive are you? So reaction, or the reactivity of a person, is the ability to respond without being excessively anxious. And other studies have also shown that Bhastrika Pranayama helps reactivity, but not without having a spike in anxiety. In other words, if you are in this situation and someone tries to cut across the tracks, if you are regularly practicing Bhastrika Pranayama, the research evidence suggests you will be able to respond to it very effectively and quickly, but without having a spike in anxiety. Isn't that something we want all the time, leave alone during this time of the pandemic? So moving on to another area, Sritali and Sidhari Pranayamas. There are two facts here. We undertook this research and published it this year because we were really curious to see, do these practices, you can see here Sritali and Sidhari at the bottom of the slide, do they really reduce the body temperature? This is because they've been actually used effectively in low-grade fever, pyrexia, and helped people to reduce the fever. So do they really help? And when we actually studied it in the lab, the body temperature does increase a little, but within the physiological range. So it may not really reduce the body temperature, but it does increase the energy expenditure. So like Kapalabhati, by just breathing out through your mouth, either through the clenched teeth or by, breathing in, through the clenched teeth or through the tongue, you're able to spike up your energy expenditure So isn't that an easy way to exercise? 9% as opposed to 41% in Kapalbhati, but still very effective to burn calories. Moving on to the last category, Bumble Bee Breath. This is a very interesting study which was undertaken in 2006 in Karolinska Institute. And this was not on bumblebee breath. They looked at humming, like a person who just hums under their breath. Now what happens? Something very interesting. For this, we need to know a little bit of functional anatomy. All around our face, there are the bones, skull bones, and in the bones, there are spaces called sinus. So sinuses. And in these sinuses, we produce a large amount of a particular gas called nitric oxide. Now, this is a very important gas. It has a number of very interesting functions, and we'll see those in a minute. This person in Karolinska Institute showed in 2006 that, and this was subsequently published in JAMA and a number of very excellent journals, that if you do humming, the nitric oxide is increased in the nasal passage. Now, this was very exciting because nitric oxide has a drastic effect in reducing infections, in reducing wrong excessive inflammation, and even facilitating mucus clearance in the upper respiratory tract. And it has actually been used very effectively in the management of sinusitis. So we can see here a very excellent application for Bhamri Pranayama. Incidentally, it has not been studied. We are beginning this research at the moment in Haridwar. So this is one of the very interesting applications, and there's every indication that with the practice of Bhamri, we can really push out this nitric oxide from the sinuses into the nasal passage. And as we know, upper respiratory tract is the one which is terribly vulnerable in the case of COVID. So if a person is to practice Bhamri, they would have this nitric oxide flooding the nasal passage and potentially helping them by reducing the risk of infection, inflammation, and even helping mucus clearance through ciliary action. So there's every reason then to practice this very quietening and relaxing practice. Incidentally, the research on Bhamri is very minimal. A lot more can be done. So I want to really come to an end. I didn't want to exceed my time. So there we can see that there are certain pranayamas suggested by this which may be useful in the active phase if we talk of that as the time a person tests positive, or someone who lives close to a person who is tested positive. What should they practice? Based on this evidence, it would be possible that the most useful would be Anulom Vilom Pranayama, Bhamri, and the cooling pranayamas, the so-called cooling, which are not actually cooling in terms of body temperature, but maybe cooling in terms of the mind. There's preliminary evidence to suggest that this combination would not only help the respiratory system, but also immune system and of course the mental health. Whether one could add Bhastrika and Kapalbhati would depend on how symptomatic, or if they have already some problem with the respiratory system, in which case they could do it, but they would be advised to seek very expert pulmonologist advice, because they are slightly active practices involving respiratory maneuvers. Of course, in post-COVID living, for all of us, all the practices mentioned here have a very strong role, and that is because pranayamas are probably the most powerful tools, as mentioned in this very beautiful verse from Hatha Yoga Pradipika, which says that when prana is without movement, then the chitta too is without movement. And so we can actually steady our mind by restraining vayu. So what a wonderful way to do it, and that is the best possible way through pranayama, with which I will end and say thank you.
Thank you very much, Dr. Telles. What a wonderful presentation, showing us so much research on different aspects of pranayama and how useful they are. Thank you. Thank you. And now our next presenter is my good friend, Dr. Dilip Sarkar. He's a retired vascular surgeon. He retired as an associate professor of surgery at Eastern Virginia Medical School, Norfolk, Virginia, and now teaches yoga therapy, Ayurvedic philosophy, and Ayurvedic yoga therapy, both nationally and internationally, to healthcare providers in USA, with a focus on integrating yogic and Ayurvedic wisdom with the science of Western medicine. He is a certified yoga therapist, certified Ayurvedic yoga therapist, yoga acharya, and an Ayurvedic practitioner. Dr. Sarkar started the first category 1 ACCME approved continuing medical education course in the USA for physician yoga therapy for medical professionals in 2010. He served on several local and national healthcare boards, including as past president of board of directors for the American Heart Association, Hampton Roads chapter, Virginia, and immediate past president of the board of directors of International Association of Yoga Therapists, chair and chairman of the board of Life in Yoga Institute. Last year, he was awarded Doctor of Letters called D.Litt degree in yoga by a very well-known yoga university, SVSI in Bangalore, India. His book, Yoga Therapy, Ayurveda and Western Medicine, A Healthy Convergence, has been well received by the yoga therapy, Ayurveda and Western healthcare community. Dr. Sarkar and I have been conducting Patanjali Yoga teacher training workshops since 2009, and I always call him Dilip Bhai. So please, let's welcome Dr. Sarkar.
Namaskar, Shekhar.
Namaste.
Namaste. As you said, I'm a vascular surgeon, and I have seen all the practices. Jaideep ji and good friend Shirley gave it to you. So I left my slides out. No slides. I'm going to guide you to the path of COVID-19. What we have learned in last 6 to 8 months, and how yoga as a therapy is integrating in that treatment, prevention, and follow-up of COVID-19. Let's start with what is COVID-19. We call it a novel coronavirus. Novel means new. Covid, see the word Covid, CO for corona, VI is the virus, D for the disease, and 19 is, it was diagnosed in 2019. So novel coronavirus, first, we really don't know what's going to happen. So we have a panic, fear, anxiety. And then what happens, there is a group of people on us who first started for a denial. Hey, nothing, it'll go away. Denial gives us an anger, gives us a revenge, gives us acceptance. And yoga, as you know, yoga as a therapy is the philosophy, Yoga Sutra of Patanjali. If you look at 196 sutras, of which 193 is your quieting down your mind. So the mind quiets down with yoga practice, and we will be able to handle this. Even the practice, 8 limbs of the practice, what it ends up with, yam, niyam, asana, pranayam, pratyahar, dharan, dhan. It ends up with the dhan, meditation. Meditation is the medication. Then we started learning it is a respiratory virus. It's a respiratory virus. It comes through our respiratory channel, comes through our nostril, it comes through our mouth. So we practice as a yoga therapy. As you know, yoga therapy is holistic. A part of yoga therapy practice is our daily routine, dinacharya. So the practices what Jaideep ji was showing, let me tell you, I do it. All of my followers do it. Wake up in the morning, first thing in the morning, we sit down in a squatting pose in a malasana. We hold a copper glass, drink a glass of water, little lukewarm water, Ushapan. After Ushapan, we brush our teeth. I'm going to scrape the tongue. So if the virus is coming from my mouth and nostril, if there is settled in my tongue, I'm removing it, prevent it. Next, daily, I do a jalneti. So I'm doing a jalneti, not that I'm doing it when I have a COVID or when I have a flu. It is my lifestyle. Every single day, I have done it for the last 20 years. I have not missed a single day, whether I'm in the plane, I'm in the train, I'm in the hotel, nothing. So it's washing away the viral load. Then the virus is going to your lung. And look at what it's doing in the lung. First, remember the corona. Corona is going to attach to your alveoli, the lung lining. The way it attaches, it's a little medical term, but all of you probably know about it, is through enzyme called ACE2. A stands for angiotensin converting enzyme. Guess what? All of our cardiac patients, whether it's a coronary artery disease, hypertension, diabetes, metabolic syndrome, they're all on a 4 medication called cocktail: aspirin, statin, beta blocker, and ACE inhibitor. So you are hearing that people are having a more incidence of COVID-19. People have a cardiovascular disorder. So it acts through the ACE2 enzyme. But then what it creates inflammatory response. It's called a cytokine storm. We also call it present day, we call it a bradykinin storm. So a practice of yoga, as Shirley was still showing it to you, is the nitric oxide, have you seen? And the whole practice of yoga as a therapy is your relaxation response, activation of parasympathetic tone. It is anti-inflammatory. In fact, it is anti-thrombotic. Next, what happens? Present day, we see there is a very fine studies and seeing a large number of patients that COVID-19 is creating is called a DIC. DIC is called a disseminated intravascular coagulation. The blood started to clotting. One of our therapy today, when the patient comes in, we look at your blood clotting, the diagnostic test. We started them on anticoagulants. So the present concept is that it also causes thrombosis of the blood vessels, even maybe in the lung, in the heart, the rest of the whole body, and creates a tremendous amount of response. Practice of yoga therapy is anti-thrombotic. Next, the inflammation is filling up the lung, and slowly the oxygen gas exchange is going down. One very interesting thing about COVID-19 patient is that when the patient starts to get the lowering of the oxygen, we call it the oxygen saturation, they do not get a symptom. There is a term now called a happy hypoxia. People has come to the emergency room with oxygen saturation of 70, 80, still have no symptoms. Amazing. Because the lung is like a balloon. We have a vital capacity of 4.5 liter, and normally we only breathe 0.5 liter. 80 to 90% of our lung, we have a reserve. So what we are doing in the regular yoga therapy practice, the first pranayama, you have seen all the pranayamas, but the first pranayama, you learn how to breathe out. Then you start how to breathe in, and exhalation is longer. Exhalation longer than inhalation. And physiologically, we know exhalation is parasympathetic, inhalation is sympathetic. And, during this process is there, when you get a nasal breathing, when the air is going through your nostril, you are secreting the nitric oxide from the mucosa of your sinuses. This nitric oxide then acts as a mediator of parasympathetic tone. Parasympathetic nerve is mediated through 3 substances, primarily nitric oxide, another called cyclic GMP, another called acetylcholine. So the exchange of air gets better and better because your exhalation is longer and inhalation is shorter. Then Shirley has shown how the Anulom Vilom Pranayama, Bhastrika Kapalbhati. So I'm not going to go into the practice, but let me go to the next step. So what happens in the lung? In our yoga practice, lung and heart is the same organ. Now it's going to affect your heart. Affecting of the heart, primarily today in a COVID-19, also have a direct effect on the heart. It is called your myocarditis, inflammation of the heart, and the function of the heart is going down. So what is the effect of yoga therapy in our body? The first, we call relaxation response. It's a two medical terms, but you will understand. It is called the relaxation of the peripheral arteries, reduction of the called peripheral resistance, and it is called the reduction in the afterload of the heart. That means heart can function little better when you are practicing yoga therapy. Also with the pranayama, what you do, it is called the retard of the heart, the blood coming through your lung is more. It is called a better preload. I'm going to finish in a few minutes, but before I tell you, look at the sequence of COVID-19, what happens. Inflammation in the lung, then it's going to affect in your heart. Then it goes into the phases, it's called the septicemia. The infection has gone to the blood, and infection in the blood is called septicemia. Then it creates a phenomenon called a septic shock. Now your blood pressure started coming down, your body perfusion coming down. You started having a phenomenon called multi-organ failure. Then you develop a kidney failure. If you have a liver failure, it is the end of it. So what is the ultimate effect of yoga therapy of your COVID-19? So look at a scenario, a person who is dying. The person who is dying, we say expired. Means his last breath has come out. When the lung stops, then the heart stops. When the heart stops, then the brain stops. When the brain stops, all the cellular function stops, and the person is dead. So on the other hand, in the yoga practice, what you're doing, you are improving the lung function. When you're improving the lung function, you're improving the heart function, improving your brain function, improving your cellular function. So it is as simple as it is, but the most important practice is what yoga as a therapy means, the adaptation of the yoga practices. We use the same Yoga Sutra of Patanjali. We're using the same Patanjali Ashtanga Yoga, but we learn how to use it and make an adaptation on the person's or patient's clinical condition. So today we are seeing that as a prevention, as an integrative medicine, where you need a supportive therapy, you do. And even post-COVID, the practice of all this thing, Jaideep and Shirley are showing it to you, are excellent in a part and parcel, and we're using it every single day in our practice and in our teaching. Thank you for your time, and we'll be glad to answer any questions.
Thank you, Dr. Sarkar. What a wonderful way to tell us in a very basic language we can understand what's going on and how these yoga practices can work our lungs, heart, our brain, and the whole body. You know, you combine Western medicine with yoga, Ayurveda, and as a representative of Patanjali YogPeeth here, I get so many questions from so many people. And Dr. Sarkar is the first one I go to. So thank you so much. And now our last but not the least speaker is Dr. Rajan Narayanji. He is a scientist who has been teaching yoga since 1998. In 2010, along with Dr. Sarkar, he launched the first continuing medical education course or CME course in yoga, and subsequently formed Life in Yoga Institute in 2011, which became the first yoga institution in the United States to get direct accreditation to offer CME program. While most of the yoga research has been in the platform of modern medicine and its physiology, Dr. Narayanan uses electrophotonic imaging, went on to develop a system called measured yoga therapy, that integrates the wisdom of yoga with modern psychology and also serve as a bridge between modern medicine, yoga, and Ayurveda sciences. He has been able to reverse incurable disease conditions, including chronic and autoimmune conditions. His visits to Houston in 2016 became the fountainhead to build awareness of this system. And today, the service is available in 12 metropolitan locations in USA. And I know a few of his patients firsthand who are my close friends also. Dr. Narayan largely uses Tantra yoga approaches with integration of Hatha yoga and Bhakti yoga. As every part of the body has its own vibrations, based on this understanding and using different mantras to restore the heart, the lung, the spine, etc., he has also developed a powerful mantra to energize the respiratory system that has been successfully used by those with the COVID-19. At present, he spends most of his time in therapy, training of other therapists, and research applications for various health conditions. And with all these activities, even he daily conducts 2 yoga online sessions, and hundreds of people join him in these classes. So with this short introduction, I welcome Dr. Rajan Narayanji.
Namaste, Namaste ji. I'll just throw the PowerPoint right onto the screen over here, and we can begin. Okay. Oh, I'm on the last screen. Okay. 1 second. Okay. So the topic is, of course, all of you know. So I'm going to touch on 4 subjects: nature of the immune system, yoga model of the human system, the role of mantra, and validations which we have conducted. Now, obviously, when it comes to the nature of the immune system, we have had some discussion over here. Dr. Jaideep Arya did mention that earlier on, and so did Dr. Shirley Telles. Now, there are 4 references here from PubMed, which is the National Library of Medicine, which I have put over there. And we know that sleep, Dr. Vaidya mentioned, Dr. Arya, sorry, mentioned that the importance of deep sleep related to immunity. Now, there are 2 aspects of immunity: the innate immunity and adaptive immunity. The innate immunity is the memory in the white blood cells. However, the adaptive immunity, from conventional medicine perspective, is associated more with the role of vaccines and how they adapt to bring a new thing. However, from a yogic perspective, we look upon the source of adaptive immunity as coming from cosmic connectivity. And that's what Samadhi is all about. So on a daily basis, when we have deep sleep, we say we get our daily downloads of antivirus and program updates. And this is associated from a Ayurvedic traditional yoga perspective, the 5 Panchabhutas, the element, the space element. And so the perspective from a yoga perspective is that we are all instruments of the cosmic flow. And all of us have a little wireless modem. When we learn to activate it, then we become yogis. And then, of course, the Samadhi state helps you that. But in the meantime, for people who have not reached that stage, sleep is what enables that. And that is why good sleep is very important. And that's how we also realize our purpose of life. And we say that's how Swadharma unfolds for each person. The yoga model we have, I'm going to talk about the traditional medicine and with the modern medicine side. We talk about 3 bodies: the causal body or the spiritual entity, the subtle body or the electromagnetic body, we also call it as the vibration body, and then the gross body. Now, in traditional medicine, whether it's Ayurveda or Chinese medicine, they call it as Nadi Pariksha or Nadi reading. They use 3 fingers to measure that. Today, the same of that is available in an electrophotonic imaging way. And what this enables is scientific and objective measurements. So what we do is now in modern medicine system, we are only focusing on the gross body, the physiology. Actually, when Shekharji mentioned about bridging, he said psychology and traditional medicine. Actually, it was physiology, and traditional medicine is what it was. So if we look at the physical nature of existence and the zone of medical measurements in conventional medicine, we are looking at chemistry, biochemistry, and the physical body. However, in the traditional medicine system, we are looking at the biomagnetism, and that is in the zone of yoga and traditional medicine system. And this can be captured through electrophotonic imaging. And this we do by putting each finger in an electromagnetic field. And we are able to, from the interaction, understand how 41 different organ systems are doing. And what is the role of mantra over here? There are vibrations for every body part. The musculoskeletal is the earth element. The circulation is the water element. The gene expression is the fire element. The immunity is the space element. And the vitality is the air element. So what we have is this mantra, which is very simple. Haim, Im, Haim corresponds to the earth element in the chest area. Im is the fire element that triggers the cardiorespiratory system. Is the immunity element. And so this thing is available, and we have recorded it for 2 hours, and the 2-hour recording is available for anyone who want to use it. And I will give you a few validations about how this has worked for different cases. Initially, when we tested it, there were 2 people, one person with a very acute flu-related symptoms. The joints are, aching. There is a fever going on all the time. The throat is feeling bad, and it was a dry cough actually. And then the chest was, the vitality was very, very low. And the person did this mantra for 3 hours. And lo and behold, he completely came out of the flu the next day morning. Just 3 hours. The second person we tested was a person who woke up in the morning with heavy congestion and feverishness. And the person did this mantra for 3 hours, for 30 minutes, for half an hour. And the person overcame all of that, and that low vitality was fully gone. Then we started with COVID testing. In the COVID testing, the best measurements we got was from a former nurse. Unfortunately, we are not organized in such a way whereby we have access to COVID patients, nor can we do it in a controlled setting. And so because we could not do that, we had to rely on working with wherever we knew people and we communicated. And the best measurements that came from this former nurse was a person who actually took the pulse oximeter and was looking at oxygen concentration and all of that. And this person actually found each time she did the mantra, that would happen for her. So we have anecdotal evidence from 8 others. In the interest of time, I'm going to quickly go through and tell you more about it in the end when I have the time. But there was one patient on whom we could use electrophotonic imaging to actually test what happened to the immune system. The pre-test was, it showed the immune system had 4.25 joules of communication. The left side, the adaptive side, was 4.82, and the right side was 3.68. And this person was a person with mild symptoms. And when the person went on to, did this practice for half an hour, and we took the nadi measurement with EPI, it came out to be 5.37. You can see the significant jump from 4.25 to 5.37. Now here, again, the adaptive system was like 5.8, and the right side was again like 4 point something. And that's not available on the screen, but my next slide, we can see over here, if you look right in the middle over here, the before immune system, you see the orange line, and after is the blue line. And the same thing, you can see how it has expanded in both the right side as well as the left. I won't spend too much to tell you. From a traditional medicine perspective, the right side is considered the maintenance system of any organ, and the left is considered the adaptive system. So we see that both over here. Now you can see the blue is more prominent. And so you can see the blue has how it has expanded outside it. And so now my 8 minutes has run out, so I'll very quickly conclude. The conclusion is we find that this negative impact of COVID-19, and it enables quick recovery from flu-like symptoms. So in effect, this mantra has been very, very useful for improving the cardiorespiratory immune system, as well as very quickly recovering out of it. And we have had only one person who was in a hospital kind of situation, and I don't have the time anymore. In the later question answer hour, I can tell you more about it. So with that, I will end over here.
Thank you. Thank you so much, Dr. Narayanji. It's such a wonderful presentation. And I know I have seen his techniques and this technology firsthand with many patients in Houston. And I know it's happening in many other cities. And we are looking forward to his services at our Patanjali Yoga and Wellness Ashram upcoming in the 2022. And I can say that, you know, that 1.5 hours of daily classes Dr. Narayan does online, which is basically consisted of subtle exercise with the breathing exercise, pranayama, and a chakra awakening meditation. Really, it is so powerful, and it can keep everybody very, very healthy. Thank you, sir.
I have one request for Shirley. Since you have the research capability, what I had recommended to somebody in India was to test this with Om mantra versus the Haimim mantra, as a Om as the, you know, as another one, to see the effect on maybe 20 patients, where if you have 10 of them who are in hospitalized condition and 10 of them who are not in hospitalized, but, you know, weaker symptoms, and you divide them, you know, 50-50% with Om and this one, and maybe that would be a very interesting research where you could consider. So think about it.
Sure. It will be, we can definitely consider it, yes.
Thank you.
Thank you. And this concludes our remarks by our distinguished speakers. I'm watching the time also, but now we will have a Q&A sessions. All participants who wants to ask the questions, they can click on the participant link, and there you will see on the right side of your window to raise hands, and we can see the raise hands, and we can unmute you to ask the questions. And there are some questions we have received through the
Shekharji, you're muted. Shekharji, you have to unmute yourself.
Yes. Okay. All right. Now, can you hear me? Yes. Yeah. Okay. Sorry, sir. Yes. So we are. Thank you for all our distinguished speakers. Now we are to the Q&A session. The participants in the Q&A, they can click on the participant mark, and on the right side of their window, you will see the raise hands, and we will recognize your raise hand, and we will unmute your speaker. And we have received some questions through our chat box here, as well as through the Facebook. And I will read some of the questions here. People are asking, do we have Patanjali products available in United States? Yes, there are many retail centers, and I know of one in Atlanta. You can Google there, go to their website, ramdevproducts.com. They carry the most number of products I know of. And is Coronil available in USA? I understand they have it also. Giloy is recommended for anybody on a daily use, whether you are suffering from COVID or you are healthy, to avoid any kind of chance to get COVID. It's a very good immune booster. And then we have some questions. I would point this to Dr. Telles. Can Kapalbhati induce blood pressure? By Leena Ektare. Ashok ji ask pranayam karne se sir dard ho jata hai, that doing pranayam causes headache, and that I would request Dr. Sarkar. And there is another question to how to control pitta, and Dr. Jaideep ji with his background can also answer that question as I get started with these, and I will find many more questions for our distinguished speakers. Please, Dr. Shirley Telles.
Yeah, the question is, can Kapalbhati increase the blood pressure? So let me answer this in a very clear way. Our early research, which we did in prior to 2007, looked at Kapalbhati practiced at the rate of around 120 breaths per minute. So it was very fast and carried on for just 1 minute. This was done, as Shekhar ji mentioned, when I was at SVASA in Bangalore. When we do it at the rate of 120 breaths per minute, very briefly, even for a minute or two, it does increase the sympathetic activity and can potentially increase the blood pressure over time. If you do it at a much lower rate, which is what I did mention in my presentation, around 45 to 60 breaths per minute, we evaluated the sympathetic and parasympathetic activity as well as the blood pressure readings. And what we found was that there was no increase in sympathetic activity at the rate of 45 to 60 breaths per minute, which is the rate recommended by Patanjali YogPeeth. And also, there was no spike in blood pressure readings. So I would say what is very critical is the rate of breathing, rate and the force. So of course, a person should be able to effortlessly contract the anterior abdominal wall in exhalation. That's very critical. And do it at a 45 to 60 breaths per minute rate. Then it is really safe. But of course, if a person already has dangerously high blood pressure levels, then they need to be careful and do it with adequate precautions of consulting their physician who's treating them for hypertension. I think that should answer.
And Dr. Sarkar, regarding the pranayam causing headache.
Okay. So first of all, we practice what is called the yoga as a therapy, yoga therapy. A whole yoga therapy practice is a relaxation response, activation of parasympathetic tone, and listening to your body's signal. We really is not going to compete with anybody. So for the Kapalbhati Pranayama, when you are going to do, we really don't go and sit down on a chair and start doing a Kapalbhati Pranayama. First, what we do, we teach you how to able to sit down with your spine straight, how to able to do an asana called Sthiram Sukham Asanam. You do the Sukshma Vyayam, you do the relaxation of your shoulders, relaxation of your neck with a Brahma Mudra. And once you're relaxed, then we listen and look at your breath. What is your breath? Annomaya kosha to pranomaya kosha. Any imbalance you create in your physical body, it shows up in your breath. So your breath is completely effortless. Exhalation longer than inhalation. At the beginning, you may able to do about 30 seconds. It's okay. Stop it, because it is phenomena called a neuroplasticity. By the practice, what is called a habit, you will develop more and more. That's how we started. We started from nowhere and look where we are. What happens is that as a medical personnel, we know if you keep on doing any breathing, little faster rate, whether it is a Kapalbhati Pranayama or a Bhastrika Pranayama, you develop a phenomena called a hyperventilation syndrome. In a hyperventilation syndrome, you have a tremendous amount of symptoms. You had an altered sense of consciousness, you have a cerebral vasoconstriction, you have the sarcomoral numbness, carpopedal spasm. So you may have a headache. Any symptoms you get in any pranayama practice, my request is that you start doing slowly, start doing effortlessly, start doing after relaxing your physical body, as if the whole practice is your savasana, whole practice is a normal, effortless breathing. And how do you know? You'll be able to talk, you'll be able to sing when you are doing a pranayama practice, and guaranteed you're not going to have any symptoms from the practice of pranayama yoga as a therapy. Thank you.
Dr. Jaideep Ji, can you please highlight how we can control pitta? I know Dr. Shirley Telles also talked about Sritali, Shitkari Pranayam.
Definitely. First of all, I really thankful to Dr. Shirley Telles, Dr. Dilip Sarkar for overruling the myths of doing pranayamas, doing Kapalbhati Pranayama. And my pranams to Rajanji also. The question is pitta. Sam doshaha, sam agnischa, sam dhatu malah kriya, prasanna atma indriya manaha, swast iti avidhiyate. Sam doshaha, sam agnischa. दोष सम अवस्था में होने चाहिए. दोष means वात पित्त कफ, equilibrium of वात पित्त कफ is your health. Some agnishtya, the fire in balance is called the health, and pitta means that the change of imbalance of your fire, imbalance of your pitta. That is called, in modern medical science we can say, that is the acidity, hyperacidity. And that is all due to the inadequate sleep and with the wrong eating habits. We'll take tea, coffee, alcohol, that cause the imbalance the pitta tattva in our body. And I recommend Vajrasan after the meals, Chandrabhedi Pranayam, Shitli Pranayam, Shitkari Pranayam is highly effective. And for the sake of postures, Uttanapad and Mandukasana is highly effective. And Ayurvedic, I recommend Mulethi. Mulethi you can use after the meals, and Saunf, Ajwain. Saunf you can, रात को आप यदि भिगो लें और उसका पानी पी लें. Have the water of the Saunf, Methi Dana, Avipattikar Churan, these all are the names of the Ayurvedic products. Avipattikar Churan is available everywhere. Parval Pishti is available, Moti Pishti, Kam Dudaras. And one meal, I recommend one meal, you should sit down on the earth with the cross legs so that you can have proper blood circulation in your stomach area. That will definitely help you out to relieve from the hyperacidity. Thank you.
Thank you. Thank you, Dr. Jaideep Arya ji. And we have many questions. I guide towards Rajan Narayanji. One is people are asking, okay, where do you find the mantra? Him, Dr. Rajan Narayanji talk about. And so he can guide on what site, and also how to chant this mantra. And maybe also guide how people can join your classes. What is the address? And also before Dr. Narayanji answers that, people are asking, is the Giloy same as aloe vera? No, Giloy is very different. It's called Amrita. मतलब जो आपको मरने ना दे. It's a nectar. I mean, it is a nectar here on the earth by the God. So just Tinospora is another name for it, and just Google if you are not familiar with. And aloe vera is wonderful plant, Grit Kumari, जो Grit जैसा taste और जो सदा jawan rakhe aapko. So these are both are very good, but two separate things. Another question is a very important question. Our Dr. Telles and Dr. Dilip Sarkar ji can give us more information, which is also personal case with me too. Bimala Ramsumer from Trinidad is asking that she is having COVID for last 4 months. There is no symptoms, but I guess she's going through the testing, and the virus is still there. And you know, last Saturday, I mean 8 days back, there was a camp by our Harris County to do the testing, and I went through that, and I was positive also. You know, I mean, I was infected in middle of July with little symptoms, but since then I never had any symptoms, and I still don't have any symptoms. But that bacteria or virus did show up in the test. How that is still showing up, or if you can comment on that, that would be very helpful. With that, Dr. Rajan Narayanji.
Okay, the first question about how is it, where one can find the mantra and how one should do. I'll cover how one should do right now. When people do it, the most effective way is to visualize a line from inside the sternum in the middle of the body and feel the flow of the mantra go out of the head from the top. So it'll go like Hai Mem Hai Mem Hai Mem it flows out. It's only, you visualize that. And there is no need to chant the mantra, it's something mental. Now, the 2 hours of recording that is available, if a person simply wears it, listens to it, and just visualizes that, that's good enough. Now, if a person has difficulty visualizing, we tell people not to let the mantra stay in the body, but keep the awareness above the head. Because if people don't let it flow out of the body, we have found people develop uncomfortable sensations. And so it is important for it to go out. So that is the right way to do it. Now, how can you go and get the this mantra, the whole recording? It's very simple. If you go to lifeinyoga.org, this is our website, and you go into the upcoming events section right on the top, you will see the daily online yoga, and we had this also put in over there. And if you click on the daily online yoga, it'll allow you to register for that. And the other thing also, there is a contact us page over there. If you ask, they will send you the recording link. And the other place is, if you join the yoga over there on a daily basis, our general manager, who is Bal Mukundhar, he sends out an email to everyone with the link of the mantra at the bottom of every email. And this is for the reminder for the yoga session every day. So he sends the mantra out link to everyone. So this way, it is available for everyone. And of course, because he doesn't want anybody to commercially profit from it, he has also applied for IP for that intellectual property, this thing. But it is freely available to everyone, and anybody who wants it can use it. Okay, so that is it.
Thank you, Rajanji. And now I'll request our Dr. Telles to highlight something on this virus still staying in the body for so long and not having any symptoms.
As far as I can understand, since there are a lot of things being understood still about the virus, there would be two possibilities. One could be that there are low levels of the virus present in the body, for some reason the body is not shedding the virus, which is normally typical. That is, a person who does not develop symptoms especially should be able to shed the virus. For some reason, in people like this, there are the virus is present. It is in a dose which is not adequate to produce symptoms in that particular person, but also the person's body hasn't adapted to it adequately to shed it. This is one possibility. And then our whole question is, can we drive the body to shed the virus through yoga? The second possibility is, and this is a real possibility nowadays, is the person getting reinfected repeatedly. This is something we cannot rule out. So both of them, I believe, there is something that yoga can do, facilitate a shedding, as well as prevent cycles of reinfection, which are typical in a pandemic of this sort, and is a real threat for everyone, even people who have tested positive. Maybe Dr. Sarkar may add something at this point, and then I could still say my ideas about how yoga could help for these two possibilities, if that's all right.
Okay. Question came from Vimala. Vimala, thank you. She's from Trinidad, and she's always in touch with me. Yes, Shekhar, you know her too very well.
Yes.
Okay. Vimala, you've been positive for 4
host.
months. Yeah, she was our host. You've been positive for 4 months. So the possibilities are, the first, what test you have done. There are 2 tests. Remember the virus, one has a surface antigen, and then it is actually a RNA virus, it's called a messenger RNA. In fact, that is RNA being used for making the vaccine. So PCR test. The antigen test is very quick, but reliability is a lot less. There's a very high degree of false positivity. And the other test, which we are looking at the particles of your virus, but the test itself now determined, called a viral load. This is a new word is coming up, and this is a thing we learned in last 6 months. Based on the viral load, you may even need to be treated in an asymptomatic patient. So for example, our President of the United States got positive, and I don't know if you know all of it or not, he got a monoclonal antibody. He got a monoclonal antibody in addition to the antiviral drug. Why? That monoclonal antibody is only given when there is a high viral load. Now it has been showing more and more, even what CDC is recommending, that if you being a positive with even a high accuracy COVID-19 test, if you are asymptomatic, listen to it. This is the CDC's recommendation, and they are again doing back and forth. After 10 days, being asymptomatic, you don't need to do anything. So, Vimala, if you're asymptomatic, you'll be fine. You don't go and keep on doing the test repeatedly. Same as for Shekhar also. Shekhar looks so good. Shekhar, I don't know why you went and got another test. This is the CDC recommendation now.
It was at our Arya Samaj, so we went to support them too. And so,
okay. Next thing what you need to know and learn, I'm sure we have a lot of physicians here, we know, that all of the knowledge we have of the virology and the knowledge we have as a public health, everything has failed with a novel COVID-19. So what happens, we are learning every single day. If you look at like a New England Journal of Medicine, is a Bible of our medicine, 80% of the articles now on COVID-19, I'm reading all of them, looking at it. So coming back and back and back, please, if you are asymptomatic, if you are not in a healthcare provider, or if your job does not require to be tested, CDC is recommending now not to get tested. Remember, the testing is called the prevalence. Prevalence means you take this group of people, you want to do a test to see how many percentage of people has a positivity, but most of the things are done today now is that if you get a 1 positive, if you're asymptomatic, after 10 days of quarantine, you don't have to do anything else. And the positivity rate is primarily due to called a viral load.
Thank you, Dr. Sarkar. Wonderful. We are already past our scheduled time. but I want to say many people are asking if the presentations will be available. We would request speakers, and we will put it on our Facebook page, please. And we'll take the last questions here from Yogacharya Lalit Kumarji. I'll unmute you, and you please ask your question. Thank you for joining us.
Thank you, sir. My question is, as a post-COVID symptom, that's a very common thing, is loss of smell. So what are the suggestions as a yoga therapy for the same?
Dr. Sarkar, you want to take that, please?
Yes. So, smell, if you can look at loss of smell, it is obviously, we call it a neurological function, but from the yogic standpoint, it is our pancha indriya. We have the 5 senses, and we are able to create a yogic practice which really improves the function of our 5 senses. So what is the important thing about the 5 senses is, then the yoga says that if you try to create a phenomena of which you get the frequencies of the brain and the frequency outside, it interacts, it clashes, and it's called a harmonic resonance. So this is a practice we call a Bhamri Pranayama. We recommend a Bhamri Pranayama for people who have some so-called loss of smell and some other unusual. We are seeing a lot of people having a DVT and the numbness in the leg post-COVID. So we'll do a Bhamri Pranayama, and the whole mechanism of Bhamri Pranayama is you shut down your 5 senses, then you create a vibration, which vibration probably has some relation to the vibration of your brain. 2 vibration interacts, cancels, called a harmonic resonance, and you are getting some improvement of the pancha indriya. But one thing you have to remember, that whole yoga therapy is not a reductionist, it is a holistic practice. So we really do not recommend you to just keep doing a Bhamri Pranayama daily to get better of your symptoms. You have to do a daily practice, daily practice, daily practice. You incorporate a little bit more of these practices based on your symptoms. Thank you for the question.
Thank you very much, Dr. Sarkar. With this, we will conclude today's session. I want to thank everyone to join us here on this Zoom call, as well as on our Facebook page. Special thanks to all our distinguished guest speakers, Dr. Jaideep Arya ji, Dr. Telles, Dr. Sarkar, and Dr. Narayanji. Also, my sincere thanks to Brij Kambodji, Tanvi Shahji, Somas Agrawal ji, who are working in the background to make sure everything goes well. I think the session went very, very well. I ask everyone to stay safe, stay healthy, do yoga on a daily wise. Karo yog, raho nirog. Thank you very much. May God bless you all. Namaste. Om. Thank you.
Thank you very much.
Thank you, Shekhar ji. Thank you all. You did a lot here.
Thank you.
It was very good. Wonderful.
Thank you, Jaideep ji.
Pray for the health of the people of the USA.
Thank you. Namaste.
Thank you.
Pranams to all of you.
Yes.
Thank you.
Namaste all.
Namaste.
Thank you, Shekhar ji. Thank you.
Namaste ji. Namaste.
Thank you, Shekhar ji, for arranging this program.
Namaste.
Thank you, sir. Namaskar.
Namaste ji.
बोलिए क्या
Thank you, Shekhar ji. Namaste.
Thank you. Namaste. Namaste ji.
Namaste. Very nice.
Thank you.
बात कर दो.
Namaste, Shekhar ji. Great workshop.
शांति
Many, many
अंतरिक्ष
congratulations.
गुण शांति पृथ्वी शांतिरापः शांतिरोषधयः शांति शांतिर्देवाः शांतिर्ब्रह्म शांतिः सर्वगुण शांति शांतिरेव शांति सामा शांतिरेधि ओम शांति
Namaste.
Namaste. Thank you.
Thank you very much. Excellent session.
Thank you. Thank you very much.
Excellent.
All the
Amazing.
best. Nobody want to leave.